Good morning, everybody. My name is Lucia De Luca. I am Managing Director at Women Political Leaders. And today is International Health Day. And we are here with Hauwa Ojeifo. Why? Because there are different focus and facets of health on this day. We have decided to get into the conversation with Hauwa to talk about mental health for various reasons. One is that Hauwa has uh, the you have publicly identified yourself as a person who lives with mental health conditions. You have become the voice and the face of mental health in Nigeria, and not only in Nigeria. You have start up the She Rights Woman. Maybe you will explain us what it is. You have given the voice to those who are suffering, conditions similar to yours, and those who are usually not talking about these conditions, because indeed we are talking about mental health and stigma. So, Hauwa, thank you very much for being with us today.
Thank you so much, Lucia. I really appreciate it.
Yeah, it's a great pleasure. And I know that you're busy, and it's really good to know that you're busy because you're talking about stigma. This is very rare, right? Stigma is something which we hide, we don't talk, we put aside under the carpet, and we say in some language and some culture. But you overcome the stigma. You are not afraid of talking about mental health problems. So how have you reached to this point? How did you get to this point? And what are your piece of advice maybe to other people, not only people, but also legislators, to overcome this situation?
Thank you very much. For me, getting diagnosed and living with a mental health condition has been an incredible journey. So right up from before my diagnosis to the entire phase that had my interaction with the healthcare system. And then even post-diagnosis, I have seen firsthand what it's like to live with a mental health condition. And it has been quite a journey. And I would say personally, because of how my own story was, which I usually say is not that unique, the thing about my story is that I got to a point where I was, already contemplating, taking my life and all of that. And so when the diagnosis came, when I got that bit of support, it felt like a breath of fresh air. And I realized very much that, there is a lot of stigma in the society. I think it's also not to put it on any one individual. I also realized that, the concept of shame is also a very powerful one. And for me, it was something that I'd already been working on prior to getting my diagnosis, this ability to live my truth in the face of, overwhelming stigma, or, in the face of, just being in the wild, not having that sense of belonging or being cast aside or things like that. So I would say that in that regard, I'm a bit of an outlier, because on the personal level, I had done a lot of internal work with regards to shame. And I found that, I had to take a bold stance, because there's something that I like to tell people is that we, the people who have lived experience, have perhaps the most powerful tool in combating stigma. And for me, it looks like a cycle. It is, we don't talk, we perpetuate, misinformed narratives. If we talk, we get stigmatized. So it's this entire vicious cycle that, that keeps going. And at some point, we just have to, get into the mix somehow. So I find that the more I shared my story over the last 5 years, the more that sense of shame came down. It felt like I was shedding a lot of shame and stigma. And so for me, that is how I've done it. Now, more broadly speaking, with regards to the society, I do believe that, yes, the system has a lot more with regards to the role it can play in destigmatizing mental health. And, just ensuring that the perception of mental health is really like, every aspect of healthcare or some level of disability as well. And I do believe that the system has a major role to play. And part of it is, the language that we use. It's, how we are portrayed in the media. It is, it's representation, how much our voices are, taken into consideration. Do we have a seat at the table, and things like that. When we start looking at mental health from a more empowering perspective as against people and something you have to fix and deal with and alleviate, or some sort of affliction, then people, broadly speaking, are more likely to, warm up to it. And even in the midst of that, I still believe that there's a whole lot of storytelling that can go a long way in just changing how people see mental health. I know for one that just sharing my story over the last couple of years has helped people see mental health differently. So people look at it like, oh, Hauwa has this, so maybe it's not so bad. Maybe it's something that we can finally deal with. Maybe we don't have to brush it under the carpet and things like that.
Excellent, thanks you, Hauwa. But just referring to what you said just at the very beginning of your talk, you said as soon as I got a bit of support, this was like fresh air. So let's look maybe at this support, because it's very interesting. It's like a personal support or a more systematic support. Let's differentiate it and see what kind of support needs to be offered or it's needed, and who is the main supporter, the main group of support.
I really love that, you said the personal support and then maybe the systemic support, because I think sometimes we lean towards one and perhaps not the other. And we forget that it has to be a combination of the two, because social support is indeed a key aspect of mental well-being, irrespective of whether you live with a, diagnosed mental health condition or not, So with personal support, I'm looking at, immediate family. I'm looking at, CSOs, like she writes, women bridging gaps with support groups and virtual communities and things like that, creating digital safe spaces for people to be able to be completely themselves without the fear of, shame or judgment. I'm seeing all of that there. And then I'm looking at the system as well, and I'm seeing that social welfare support is very much linked with the type of legislation that is in place. And I find that a lot of countries tend to not particularly perform very well when it comes to that. I mean, we're very good in setting up psychiatric hospitals and, medications and all of that, but we forget that the ability of an individual to feel supported, to be able to co-create what support looks like for them, is extremely powerful in their own sort of journey and recovery and experience of their mental health. So I believe that there is so much more that governments and, legislators can do with regards to establishing more community-based, sort of services as close to home as possible, where there isn't that bit of distinguishable factor like, oh, that person is going in there because they have a mental health condition, which could potentially perpetuate even more, mental health stigma within the community level. So there is a lot of community-based best practices that I believe that a lot of countries need to adopt even more. Mental health at the primary healthcare level, mental health as close to home as possible. Community interventions that are by the community and for the community are extremely powerful as well. And the more I find that it works hand in hand, the more the system can create that enabling environment for social support and welfare, whether it's in support groups, whether it's in, mixers that ensure that people can come in, maybe for something slightly different, but that opens up the door for them to talk about their mental health. I find that, it is more likely, because it is these same people that make up the community, it is more likely that it trickles back into your personal support system, because it works hand in hand. The more I realize that perhaps there is a nationwide call for, mental health support and things like that, the more I am likely to be a better support system to somebody who has lived experience in my own space as well.
Yeah, Hauwa, it's just amazing to listen to you, because also there are so many streams which different people could follow on. And indeed, you talk about systemic and support, and I think that we need to look at. Certainly, women political leaders or political leaders as such have certainly a role, and you also mentioned about what kind of the importance of legislation and how some systems are doing better than others, and so maybe it's also for WPL a way of pursuing, because we have recently published a publication which is called Time for a Checkup, and we look at the state of mental health care in Europe. So I think also in our discourse, I think it's important to differentiate between mental health and mental health care, because the care is the whole system, which is made of public and community-based support, something which maybe we come back on. But before, I'd like, because it seems to be from what you said, that the importance of verbalizing, of putting in words what people are going through. It's important not only for a personal, like a cathartic moment, but also to share the experience and to make sure that that experience goes to the people that have to put in place the systems to support people with mental health conditions. So can you tell us a little bit more about why have you created She Rights Woman, and what is it for, and how is it useful to you, to other people with similar condition, and maybe to other groups which we don't, we're not thinking about now?
Sure. I started She Rights Woman 2 months, exactly about 2 months after I had, my first near suicidal attempt. And it was, for me, initially an outlet. The system didn't provide that. The environment didn't provide that. The community didn't provide that. I didn't know how to, on the one hand, speak my truth, and on the other hand, for other people to be able to receive it in a way that what they gave back was supportive enough for me. So I started to write to one as an outlet to be able to document on some level, my own experience. And what just started as, something just documenting my personal experience began to call on to other people who, had lived experience as well. And I remember when we just started, it was really about, I know this experience, what you just talked about. This is my mother, or this is my sister, or this is my husband. And, and just like that, this movement began. So we like to say She Rights Woman is a movement that gives mental health a voice in Nigeria by empowering people who actually live with mental health conditions to tell their own stories, to co-create their own solutions, and to advocate for their own rights. And we're doing that across 3 core areas for us. And one of those areas is legislative and policy advocacy. And that is partly because we are trying to ensure that, on the one hand, we're documenting lived experience, but also lived experience with regards to systemic abuses that are already in place. And so that forms enough qualitative research and qualitative data for legislators to be able to take actionable steps. We're trying to ensure that on a broader level, the United Nations Convention on the Rights of Persons with Disabilities is, domesticated fully in a way that the rights of persons with mental health conditions are fully protected, especially when they interact with the system. On the other hand, we have what is called Safe Place Nigeria. And Safe Place Nigeria is, again, our attempt at creating a digital safe space, a community of, mental health conscious Nigerians, really. And I think for us, it's really about how can we create a culture of mental wellness? How can we ensure that mental health is not this thing that we schedule as an event, once in a year or 3 times in a year? How can we make it more of a lifestyle? So it's about content and exposure, access to therapists and counselors and things like that. We launched Nigeria's first 24/7 toll-free mental health helpline. And, just in 3 months, we were able to reach over 1,200 people. And that was really incredible, because that shows that a lot of people do want to access, some of this. And then we also have intersectional solutions. And for us, intersectional solutions are our way of ensuring that mental health issues are not discussed in silos or in isolation. The truth is that mental health is, it's something that cuts across every aspect of life and every social issue. So whether we're talking about inequalities, or whether we're talking about gender, or whether we're talking about, strong institutions, or, sexual violence, and all of those other layered social issues, there is an element of mental health that either affects or, is affected, by these issues. And it's so important that we bring them to the fore. And for us, really, it's about, normalizing mental health conversations and using these new conversations to bring about systemic change as well.
Wow, that's really, it seems that, you're talking very much about Nigeria, but Hauwa, but I think that this experience is going to be, is slowly becoming global. Right? So I think that, I think you're very, you're I think, you're becoming more a global advocate than Nigerian advocate, in my opinion. So one question, which of course I'd like to ask, and we have to ask these questions nowadays, we are still facing the pandemic everywhere. Today you told me your second shot. So thanks for being with us. I know that it's not always easy. So, but I mean, so of course the pandemic told us or showed us that the numbers in terms of like impacts on people or mental health conditions are unfortunately, terrible, are appalling. But what can we learn from this pandemic? I mean, how can we use, if it's the right word, this pandemic to make sure that, there is even more attention paid to mental health problems?
Absolutely. I think it's it's sad that we had to have a pandemic of this scale for us to really come back to the importance of mental health. But I mean, we will take it for what it's worth. The numbers are, like you said, they are incredible. And, I have read multiple research and pieces, articles that are telling us really that the numbers that we're seeing right now in 2021 are nothing like what is to come. Because the full effects of the pandemic, the lockdown, and all the happenings of 2020 are yet to, fully manifest of some sort on a global level as well. But I think one thing that definitely happened was that, COVID-19, the pandemic really unraveled, our healthcare system globally. It showed us, perhaps for the first time on a very large scale, why it was very important for us to have working systems that have mental health embedded in every aspect of the system, whether it is for frontline workers or for persons who have, who had the COVID, or it was for the general population. We saw collective trauma with other social issues that were happening within the pandemic as well. We saw issues around access. We saw issues with regards to, things going digital and seeing that disparity between people who have the internet and people who don't, and how that affected the general health outcomes of any particular country or community. So I mean, it's such a layered conversation. And like I said, it's pretty sad that we had to wait for it, but I think it's a good wake-up call. And I'm really hoping that we don't let it pass by without taking necessary action. On the one hand, it was how can we ensure that, mental health care is as accessible, to anybody, irrespective of, age or class or geographical location and things like that. And we saw a lot of solutions pop up. But I think for so many countries, it was very hard to react because that's really what we were doing. Because, with systemic issues, these are issues that take time to change. So within the pandemic, it was so hard because the system was going through labored, challenges at that time, So I do think on an individual level that a lot of us saw what it was like to live with just get a glimpse of what it's like to live with a mental health condition last year, because we saw a lot of populations were recording more symptoms of depression than perhaps ever before. And, people could see how that was impacting them and their productivity and their ability to show up in their families and in their lives and things like that. But more broadly speaking, it showed us why it was so important that collectively and systemically, certain health disparities need to be closed in order for us to have true health equity across board.
Yeah, indeed, Hauwa, right. We need, as I said, change, and we need to seize this opportunity because that's what we have. We need to turn into like an opportunity. And I think that 2021 offers, maybe a key opportunity to build a society which offers more equitable solutions, not only between men and women, but for all groups and all problems that the society, the world is facing. So we have, of course, many are here with the Generation Equality Forum, which is this, visionary program running for 5 years. So it's bringing together like government, the society, corporation, root organizations, all that are called change makers. And they are change makers because they are asked to create change and to commitment for change. So you spoke of the need for change. Hopefully, these and like to dispute you, if you have the current commitment, the blueprint Generation Equality Forum, the process of addressing mental health issues is not present. So, but if this is a 5-year program, so I think it's opportunity for people leading movements like you, or you're in a situation like you, liaise with other organizations, even like governmental organizations, sure that those, the aspect of mental health is really taken into account. So I don't know if you have any hands on this front you want to reveal or unveil any ideas with you.
I mean, no, I do think it's fantastic work. I think it's a fantastic commitment. It is like any other commitment. It is very, very challenging, because we're working across, different systems with different countries that have different existing legislative backdrops and, different healthcare systems or approaches to welfare and things like that. So it is, yes, we have all of this, but it is the adaptation into different countries that tends to then be the real challenge on the ground. Is how can I take something like this and how can I bring it to, for example, in Nigeria or to somewhere in Europe, and that difference, how is that difference going to play out? But I do think that it is very, very good. I would continue to advocate for, as much as we're advocating for provision for care, it is the rights of persons with mental health conditions and psychosocial disabilities protected. Because that's what we see a lot of times, is that yes, there is access, but then the rights are being stripped away, and that can very easily undermine, the quality of care that the system gives. If it is not rights-based, then there is potentially an issue, that needs to be addressed in any system. So it is definitely something that I always try to, reiterate for us to always think about, because it's very easy to think about mental health and think about care, but then forget that, persons with mental health conditions or people that interact with the mental health care system, need to have their rights respected, because they are equal members of the society as well. And I find that is something that tends to lag very easily in many mental health care systems.
Yeah. Well, amazing, Hauwa. And thank you very much, because you're mentioning rights. And we know that not only you advocate for rights, but also you are a practical woman with really practical pieces of advice and suggestions which can be implementable right away. And I have to thank you, because you not only are the the motto behind She Writes Woman, but you're one of the co-author of the Reykjavik Manual. The Reykjavik Manual is this new innovative manual that women political leaders launched at the Reykjavik World Forum in November last year. It's now currently being written by hundreds of women leaders around the world, and you have been participating in the creation of the manual, the man created through action stages. So very close, limited number meeting, but actually people share their proposal. And this manual is a practical one, we can actions every day. And today, the manual you have co-written on health actually is being published on the Global Forum website. So I think that colleagues will also add the link to this. So I would like to thank you very much for being authoring this and for sharing your experience, because when we talk about change, the manual is really like change which people can implement, and particularly leaders like you, every single day, to ensure that that change happens not in 5 years, but happens as of today. So thank you very much for that, and also for any other action coalition that you would like to join to write other chapters of the manual. I would like to refer to the word rights which you used before, and also the conversation is it's so interesting, and unfortunately I can't keep you here for 1 hour, unfortunately, otherwise we could stay here for hours, Hauwa. But what I'd like to mention is maybe talk about rights and disparities, in particular when it comes to mental health. You are a woman, and my question is whether you felt that you have received less support, less treatments, less supported than a man, or with the similar conditions. And also would like you to focus, also in light of the pandemics, about the mental health importance, to maybe focus on children and on accompanying children. So these are the two last points I would like to touch in this amazing conversation.
Sure. So with regards to rights, first off, with regards to rights, I just wanted to
think it seems we have a small hiccup with the sound, so maybe I'll ask Hauwa. She's with us. She hears us to maybe relaunch the reconnect. And the reason why I was asking this question is because indeed there is data, and there is there are numbers who show indeed that there is a biased approach when it comes to providing adequate mental health treatments and programs between men and women, and just wanted to hear Hauwa's points of view on this specific point. Yes, Hauwa, you're back. Nice to see you. Yeah, please continue.
Thank you very much. I think if you can just repeat the first.
Indeed. The question was about whether you as a woman, you believe that there are disparities in the treatment and women and men receive when it comes to mental health, care and mental health assistance, simply because of their gender. Yes, we can hear you. Go ahead.
Okay, so I was just saying if it's possible to just get a bit of a recap on the first question, the one about the rights.
Yeah, exactly. Sure. So I was asking whether what are the disparities in your view between men and women when it comes to being, getting equal treatment in the area of mental health, support.
Yeah. Okay. So in my experience, I find that it's even there is a disparity with regards to whether it's treatment or support as far as mental health is concerned and rights are concerned for men and women. But I would say that it is not that as a woman I am treated any less. It is that I am because of the conditioning that a lot of us have grown up in terms of women are more likely, I mean, even the studies show it, that women are more likely to voice out their mental health concerns long before anything drastic happens. But because of all the patriarchy that we're all trying to kick against and really force down, men are less likely to speak up, and when they do speak up, they are more likely to be shamed for speaking up. And that in turn also, affects their health outcomes, their mental health outcomes, as far as being able to access the sort of treatment and support that they need. Because a lot of times, there's that sense of shame, even within the system for a man. It's like, oh, you're a man, like man up type thing. And it is very shaming, because indeed anybody can have, a mental health condition or a mental health problem. But in my own case as a woman, and I find this largely in a lot of places, is that, me voicing my mental health is less likely to be considered, a big deal per se, unlike if it's a man. And that's just a comparison-based thing. It doesn't mean that women are not shamed for it, or women are not told that they're nagging, or you're being hysterical, and all of those things. I think there is definitely a disparity there, and that's where a lot of work needs to be done. And not just, broadly speaking, all the solutions and efforts and all the actionable steps we've talked about will work very much for women, but there needs to be an additional layer of support, and just being generally very deliberate about how we're ensuring that the system is welcoming of men as well, as far as mental health treatment and support is concerned. But when it comes to rights by itself, I do not see so much of that, and that could be just maybe limited experience with regards to rights. I find that broadly speaking, there is that sense of almost equal abuse within the system, irrespective of whether you're a man or a woman. And this is away from treatment and support, which I've clearly said that there is a disparity. I find the systems that are not very rights respecting are generally not rights respecting, both for men and women. Now, whether the rights respecting bit is now tied to some cultural or spiritual or social type of practice is a different thing, because we know in some places that women who have children, or who have developmental health conditions after childbirth, tend to face different types of issues from, let's say, a man who has lost a child or something like that. So it's very tricky with regards to rights, because we find that it happens across the board. Now, when it comes to COVID-19 and then the impact on children as well, with a particular focus on children, I think that is a part that we definitely need to be having a lot more conversation about, because if as adults we felt it the way we felt it, I always tell people, now imagine the formative part of a child's life being subjected to a lockdown, not being able to build, that social system, living in a space filled with fear and anxiety and lots of bad news and all of that, even if they do not have the mental capacity to take in exactly what is going on, they are taking in something. And that is something that we should be very concerned about. How can we begin to reverse or be proactive about what the pandemic has done to a lot of children, going forward? So we need to also be very deliberate about developing social skills for, children, and, emotional skills as well, because a lot of what has happened, they do not have the vocabulary to be able to voice it. So like I said, it's like what you see in adults, you're seeing it like maybe 10x in children, but the truth is that you wouldn't see the effects right now. You could potentially see the effect, we look at the children and we can take that into like maybe research, and we see that, okay, how old are they? Let's see what happens at the age of 14, 15, and then let's see what happens at 24, which is typically when a lot of mental health conditions begin to, come off with regards to, behaviors. So there is a lot that I think the system has to do. There is a lot that, the educational system has to do in terms of schooling and reintegrating children back into, communities and into schools, and rebuilding social, skills and things like that. There is a lot that on an individual level, parents have to do as well, which quite frankly, if you just don't know, then how do you teach what you don't know? And if you're also being affected by something, how do you then quantify how much effect it has had on the children around you, except waiting till, it crystallizes, and then you're like, okay, there it is. Now can we deal with that? But in all of this, we also have to be building that resilience into our systems, so that when eventually we begin to see this breakdown on a larger level, because the truth is it will come. And I don't want to be like this doomsday, sort of thing. It will come. It's just what happens, we just need to be prepared. We just need to ensure that the system is prepared to respond as quickly as possible when the time actually comes.
Yeah, how I think you have, mapped out a pathway for the next 5 years. So we just need to share it now with the policymakers and ask them to implement it. So thank you very much for your clarity. I mean, you are, I didn't read aloud your biography because it's amazing and it's long, but one of the elements which we found in your biography is that you have given mental health and sexual violence a voice. And for me, it's a very clear and a beautiful voice. So I would like to thank you for that. We are now already like 3 minutes over, so we're going to close. I would like to give you then just the floor for one last maybe sentence, but before that, I would just to take, mention what I have taken note in terms of like keywords. So you mentioned about the importance of support, and you mentioned about how this support is built between personal internal work that the person has to do, but also the kind of systemic support, which is very much linked to legislation, but also community readiness of the community to provide such support. You talk about stigma and how, in your case, it was possible to overcome the system, the stigma, and how the language and the voicing of it's important, the expression, the writing, and how it's important to write a new storytelling, a new story, and you have been writing through your programs this storytelling. So we need to bring other people to share maybe their story. You also talk about resilience, because that's certainly something which we need even more now because of COVID-19, and not only because of mental health. You also mentioned about the need for change, and you gave a couple of hints and direction of how this change could be achieved. So thank you very much for that. And you also mentioned about the importance of rights to be respected. And you also mentioned how in this situation, when it comes to mental health, the situation is so bad that actually there's not group of this population who seems to suffer most, but it's something that needs to be addressed for the whole population. And you ended up with a hope for future with some avenues to explore in futures when it comes to children, and how to avoid them suffering even more because of COVID-19 and the pandemic from mental health issues. I think you told us and the viewers, so I thank you very much for those who have been following us, or have been following us on Facebook. We will put the recording up. We will be open. I mean, we had tons of other questions to ask you, but we didn't have time, and so I would like to thank you very much. So don't know if you want to leave all the viewers was following you, not us, you with a sentence to remember to think of, maybe until the next Facebook Live we're gonna have. And I thank you very much, you and your team, for this.
But thank you. I mean, thank you so much, Lucia. I love this conversation. I think it was very simple and straight to the point. Some of the most salient points have been raised, and it's for me, it's always a conversation starter. A lot of this, it's hopefully for anybody that watches it, it's about how can we go back and amplify this conversation, but also how can we dig deeper into the conversations. So for me, one of the things that I always love to leave people with, and I'm doing that today, is nothing about us without us. And for me, it is a mantra that I hold very dearly. It is whenever any policy, whenever any solution with regards to persons with mental health conditions is being considered or deliberated or implemented, please ensure that there is representation of persons with mental health conditions and psychosocial disabilities at the table, from the consultation to the implementation and to the monitoring. It is very, very important that the voices of persons with mental health conditions are championing it at every step of the way. Let us be the ones to tell, legislators or, solution providers, light bearers, let us be the ones to say what a solution looks like. Let us be the ones to say, what does it look like for my rights to be respected? And let us be the ones to say, this needs to change at any given point in time. So nothing about us without us. Thank you very much.
Thank you very much, Hauwa. And also I would like to thank once again, and I would invite all people to follow you, to follow as well, read the manual, the Reykjavik manual, and the chapter we just finished would actually be able to find some of your the intelligence you kindly with us. So thank you much, and looking forward to you soon.
Bye.